So today we're going to be testing the 12 cranial nerves. To start with, we'll go with cranial nerve 1, the olfactory nerve. So we want to make sure that the patient is able to identify an unknown substance and that it's equal between the two nostrils. So I'll have you close your eyes for me, Brooke, and I want you to close off one of your nostrils for me and identify the substance for me if you can. Coffee? Great. And I'll have you cover your other nostril.
Coffee.
Great. Do you feel like that was equal between the two nostrils?
Mm-hmm.
Awesome. So that was a normal response for cranial nerve 1. We'll move on to cranial nerve 2, the optic nerve now. So we want to test the central and peripheral vision. So we'll start out with a distant Snellen chart to do so. So I'll have you cover your left eye for me. And what's the smallest line you can read up there?
TZVECL.
Wonderful. So that's 20/20. And I'll have you cover your other eye for me.
TZVECL.
Great. So that was 20/20 as well. If there was an abnormal response, you would see a reduced visual acuity most likely in that situation. We'll move on to the peripheral vision. So I'll have you take your glasses off and face me. So I want you to close your left eye for me or cover your left eye. Look at my open eye and let me know how many fingers you see off to the side.
2,
Good.
5,
Great.
1, 2.
Awesome. So I'll have you cover your other eye for me and look right here.
2, 2, 5, 2.
Wonderful. So the response was full there. If there was an abnormal response, you would have to pull your fingers in to try to get a response from the patient if there was a constricted visual field. So we'll move on now to 3, 4, and 6 together. For 3, 4, and 6, we're going to do extraocular muscle testing. And then we'll move on to do a couple other testing with the cranial nerve 3. So for this one, Brooke, I'll have you follow my pen light with just your eyes. Keep your head still. If you feel any pain or see 2 lights, let me know. Awesome. So that was full range of motion there. So we'll move on to finishing up cranial nerve 3 testing. So we want to test accommodation and convergence with that. So I'll have you look at the G on this pen here for me and follow that in closely. Perfect. So she was to the nose. She was able to completely converge, and I also saw a near response with her pupils as well. So there was a constriction by accommodation there. So we'll move on to pupil testing now. So we want to do that to also finish up cranial nerve 3 because that's going to show us the pupil response to light. So Brooke, and normally we're going to do this in dim illumination as well. So Brooke, I'll just have you look off in the distance for me and blink when you need to. So we're testing the direct response. So I'm shining the light in the right eye and I see constriction. And the direct response in the left eye, shining the light in the left eye and I see constriction. Now for the consensual response, I'm shining the light in the right eye but making sure that the left eye constricts and there's constriction. And same with the left eye here. So consensual response, shining the light in the left eye and I see constriction with that right eye. For the last test, you want to do the swinging flashlight test to check for an APD. So we're going to shine that light and hold it in for a moment. And his eyes are staying nice and constricted there. So if we were to see some sort of abnormality there, you would see a dilation upon adding light to the eye in most situations there. So we'll move on to cranial nerve 5 testing. So there is sensory and motor aspects to that. So we'll start with the sensory aspect of V1, 2, and 3. So we'll do corneal sensitivity first with a cotton whisk. So I'll have you just slightly look up for me, Brooke, and let me know even when you feel this touch.
Now?
Good.
Now.
Great. So very sensitive. She was able to notice those changes in sensory. So now we're going to have you close your eyes, and I'm just going to lightly put this little pinpoint on various aspects of her face to make sure she's able to sense that.
Now? Now?
Awesome.
Now?
Good.
Now?
Great.
Now? Now?
Perfect. So a little ticklish there as well, but she was able to sense all of the pinpoints there. If she wasn't able to sense that, we would move on to a temperature situation. We would want a cold substance to place on those different parts of the face to see if she was able to tell a temperature difference. So now we'll move on to the motor aspect of CN5 here. So we want to kind of look at muscles of mastication. So I want you to open your mouth there for me, and I'm going to palpate your cheeks here, and then I'll have you clench your jaw for me. Good. So it's nice and symmetrical there, and it seems to be right where it needs to be. You want to make sure that there is no asymmetry between the palpating of the muscles there. So now we'll move on to cranial nerve 7. So we want to test more facial aspects, the motor aspects of the facial nerve here. So I want you to look up for me and wrinkle your forehead. And that is nice and equal there. I want you to close your eyes and resist me opening them. Wonderful. And now I want you to smile for me, frown, open your mouth, and clench your teeth again. Perfect. So everything looked nice and symmetrical. And upon meeting Brooke earlier as well, I was able to tell that overall she had nice asymmetry to her face as well. So that's a part that we want to look at for the facial nerve. We'll move on to cranial nerve 8. It's our vestibulocochlear nerve. So we're going to test hearing and balance with this. So to start with, Brooke, I'll have you just kind of scoot your chair up for me. And I want you to close your eyes and let me know on which side of your body that you are noticing a sound, if you notice a sound.
Right.
Good.
Left.
Good. All right. Perfect. Did that seem equal as well for you? Awesome. So now I'll have you stand up for me, and we're going to test your balance. So you want the patient to close their eyes with this aspect of the test. So I'll have you go ahead and close your eyes for me. And I want you to stand on your right foot for me. Perfect. Now your left foot. Perfect. So the patient was able to balance on both sides of their feet, and there wasn't any leaning towards one side. So that's a very good sign. So now we'll move on to cranial nerve 9 and 10. So we want to test the patient for a gag reflex. We also want to check the uvular displacement as well. So I'll have you go ahead and open up and say ah for me. Good. So the uvula is nice and symmetrical there. It's not leaning to one side or the other. Now I would like to test the gag reflex here. So I'll have you open up and say ah as well. Good. Good. And that was about the same response there for either side for that gag reflex as well. I'll also have you swallow for me and cough. Awesome. So the patient was able to swallow and cough. It didn't seem like there was any difficulty with the swallow upon watching, and she was able to do it pretty quick reaction as well. So you want to make sure that there's just no difficulty with swallowing and that they're able to have a nice cough there. For the last two, we're going to do cranial nerve 11 and 12. So for cranial nerve 11, the accessory nerve, we want to make sure that she's able to shrug her shoulders and resist my hands, and that it's about equal. So I'll have you go ahead and shrug your shoulders for me. Good. And she was able to resist that, and it seemed nice and symmetrical there. And next for cranial nerve 11, we're going to also test to make sure the sternocleidomastoid and neck area is also symmetrical. So I want to place my hand on your chin here, but I want you to turn your head that direction for me. And try to resist my hand. Good. And same thing on this side. Wonderful. So she was able to resist my hand again on both sides, and it was equal there. You want to check that there's no asymmetry. So finally, for cranial nerve 12, we're going to have her protrude her tongue within her cheek, and she's going to resist my hand. And then I'm also going to have her say a tongue twister for us. So I want you to place your tongue in your left cheek for me. And I want to kind of resist it there. Good. And same thing. Perfect. So she was able to resist me, and she was also able to just perform the task by placing her tongue in the cheek. Now I'd like you to say a tongue twister for me. Mama made me mash my M&Ms.
Mama made me mash my M&Ms.
Perfect. So she was well articulated with that as well. So you want to make sure that they are able to form those tongue twisters. So that concludes our cranial nerve testing today. Thanks for watching.